Hello. So it was suggested recently in a comment on one of my other videos that I should do a detailed description of music therapy as an ASMR video. Because I did mention in that video that I am a music therapy student. So I was very intrigued by that idea because obviously I love music therapy and I am happy to take any chance that I have to educate people about it, because it is a growing field. So I like being able to inform more people about it so they kind of know more about it and how it works. Although I do have to give one little disclaimer before I start my description. I recently got my lip pierced and it's a little bit swollen, so if I'm talking kind of funny, that's probably why. And I apologize for that. So I thought I would start my description of music therapy by giving the official definition. And this definition was published by the AMTA, which is the American Music Therapy Association. And they define music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Now, that's a very long and kind of complicated definition, so I'm going to break it down piece by piece and kind of put it in layman's terms. So what it means when it says that music therapy is the clinical and evidence-based, it means that this is a scientific field, and it is also a wellness field. So that's what it means when it says clinical. We work in clinical settings because we are therapists. And what it means when it says evidence-based is that this is something that has been studied a lot. A lot of music therapists will do studies with their clients and they'll publish their studies in articles in scientific journals. So this is a field which really has been studied a lot. So there's a lot of evidence to back up its benefits and how well it works for certain people. And the definition goes on to say that music therapy uses music interventions to accomplish individualized goals. So I have to describe that. When a music therapist meets a client for the first time, we do what's called an assessment, which is we observe the client and we observe their strengths and their weaknesses, as in their strengths and their needs, things that they're really good at, which are their strengths, and things that they may need help with, which are their needs. And we assess these things in both a musical and a non-musical setting. So we would observe them in a non-musical setting, such as if they're a child at school or at home, and also in a musical setting, so we'll observe them in an actual music therapy session. And the reason that we do that is we want to see if they do react better to music than they do normally. And if that is the case, then they're a really, really good client for music therapy, because music can get through to them like that. And so after we assess them, we write what are called goals, and those are basically things that we think it would be beneficial for them to achieve. And the catch is that these goals, they can't be musical goals. They have to be non-musical things. So, for example, if I were to say that my goal is my client will learn to play the piano, that's not a music therapy goal because that's just a musical goal. But if I were to say that my client will improve their finger isolation and fine motor skills by playing the piano, then that would be a music therapy goal, because having good fine motor skills is a non-musical skill, but I would be using the piano as the musical method to achieve this goal. So that explains what goals are. And it goes on to say that these goals are achieved within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So, in order to be a credentialed music therapist, you have to um, complete a bachelor's degree at a university with a music therapy program. Um, and the bachelor's degree involves taking music classes, taking music lessons, um, taking some psychology classes, some biology classes, and it's just a whole lot of things rolled into one because we don't know what population we're going to end up working with, so they want to make sure that we get a really broad education. Um, and after you complete your bachelor's degree, you, as a music therapist, you have to go and do a 6 month, at least 6 month internship at an approved music therapy site. So you would go somewhere and you would do music therapy with your clients um, and be observed by a supervisor for 6 months. And after you do that, then you are eligible to take the board certification exam. Um, and once you take the board certification exam, it's similar to how a doctor takes a board certification exam to become a doctor. Once you take that, if you pass, you are a certified music therapist. And like how doctors have after their name the letters PhD, music therapists have MT-BC, which means Music Therapist Board Certified. And beyond that, you can start working in the field. You can choose to go on and get your master's degree or your PhD if you would like, but it's not necessary to work as a music therapist. You just need to be board certified. And I also forgot to mention that while we're in school, while we're in college getting our bachelor's degree, we also do what's called music therapy practicum, which is while we're in college and we're still taking the classes and working towards the bachelor's, we get to work with clients once a week. So we have clients who get free music therapy from us because we're students, and in exchange we get to learn from them. So it's a fair trade. They get free music therapy services, and we get to learn from them how to be a better music therapist. And we are observed by a supervisor who helps us along. And so it's it's a really great thing to be able to do because it really prepares you for the field. Um, and so I thought next I would describe some of the people who we sometimes work with in music therapy. Um, Music therapy can be beneficial to almost any population. Um, we work with people with developmental or intellectual disabilities like autism or Down syndrome. We work with people with physical disabilities like multiple sclerosis or people who've been in accidents and are rehabilitating physically. We work with people with mental health disorders like schizophrenia, bipolar disorder, depression, um, trauma. We work with older adults with dementia and problems like that. Sometimes work with premature infants. Um, Really, any population out there can benefit from music therapy. I feel like so. It really is a very broad field. So yeah, basically anyone who has any kind of disorder who could potentially benefit from music therapy, but like I said, we would do an assessment to determine if they would be a good candidate or not. Um, so, and how we do music therapy with the clients is after we do the assessment, like I said, where we figure out the client's needs and strengths, and we write some goals for them. Then we do sessions with them, and we go in and we write a session plan, and we plan out what are called, some people call them interventions and some people call them experiences. which are basically the activities that we do within the session to work towards our goal. And these are music-based interventions, like I said, that are used to achieve non-musical goals. So to give an example, maybe you have a child who is having trouble with speech and cannot make the B sound, the B sound. If the music therapy goal was to have the child make it easier or have the child make the B sound, then you might bring in a song like the song Baby Bumblebee and sing it with the child. And a lot of times the song will provide motivation so that the child will be more likely to make the B sound and will feel more motivated to do it because he's so excited by the music. So that's just an example. Another example, maybe an adult with depression. You could ask him or her to bring in one of their favorite songs, and you could do what's called a song discussion, where you play the song together and you talk about what about this song do they like, what kind of feelings does the song bring up. You talk about the music and the lyrics, and this can be a really therapeutic process for people suffering with mental disorders because it helps them to express themselves through music, which a lot of people can relate to music and can find comfort in music. So can be a really helpful thing for them. Another example, an older adult with dementia, you might bring in a song that was popular in their younger years or in their childhood and play that song for them and help them kind of reminisce about memories that go along with that song. And this would help them sharpen their memory because they'd be reminiscing about the song and all the fond memories they have with the song. So that's 3 examples of music therapy. And I also brought some books. I brought 4 books which I think would be useful if you want to learn more about music therapy, or if you're interested in going into music therapy. These would be some good books to look into. This is the first one I have. It's called An Introduction to Music Therapy Theory and Practice. And this is a really good just overview of music therapy. It talks about a lot of the different populations and what kind of interventions you would use with them. And it was written by, you can see here at the bottom, William B. Davis, Kate E. Gefeller, and Michael H. Todt. And this book just is a really good overview and summary of music therapy. They've divided the chapters by population. Like you have here, Chapter 6, Music Therapy for Children and Adults with Physical Disorders. Chapter 4, Music Therapy with Children and Adults with Intellectual Disabling Conditions. Music Therapy in the Treatment of Behavioral Emotional Disorders. So it's just a really good overview book here. The second book I have is not actually about music therapy, but it's called Musicophilia by Oliver Sacks. And Oliver Sacks is actually a psychiatrist, but he wrote this book because he was intrigued by all the different ways that the mind reacts to music. So this is a really, really interesting book. It's not specifically about music therapy, but it's just a really good, really interesting book about how music affects people. And it's really, really, really great, really interesting, so I would definitely recommend this one. This next book is not related to music at all, but it's just a really great book to have. It's called The Post-Traumatic Stress Disorder Sourcebook, and it is a really, really good guide to post-traumatic stress disorder and the symptoms and ways to recover and kind of heal from post-traumatic stress disorder. I have this book because I'm just really interested in this disorder, and it's a population that I might want to work with someday, but I found the book to be really, really informative. So I would advise reading this if you have any interest in PTSD. The last book I have is the SimTap Handbook. So the SimTap is the Special Education Music Therapy Assessment Process. It was created by Kathleen A. Coleman and Betsy King Brunk. And what it's for is the SimTap is the procedure that music therapists use to assess children in special education settings who may need music therapy. And so this book goes into a lot of detail about how to do a SimTap and things to do and things not to do. I did a SimTap for one of my classes. It's a really interesting process. So this book is not really an interesting read, but it is something good to have if you're thinking about going into music therapy. And that is basically everything that I have. But I thought I would kind of finish the video by describing why exactly I want to do music therapy. I've been playing the piano since I was 6 years old, and I've always felt like I could express myself through music in ways that I couldn't with just words. And I've always felt a really strong emotional connection to music, and I know that that's not just me. A lot of people feel that way. And so for most of my life, I wanted to be a psychiatrist or a therapist because I want to help people. I want to help them kind of deal with their emotional problems or trauma that they have in their past and pain that they can't really get past. I want to help people deal with that, and I feel like music is a really, really effective way to do that. So when I found out about music therapy and I found out what it was, and it just seemed absolutely perfect for me because I've been playing music for most of my life and I want to help people, so being able to help people through music was kind of a dream come true. So that's why I want to do it. I want to work with teenagers, adolescents, and young adults who've been victims of trauma, which is why the post-traumatic stress disorder book has been really interesting to me. That's my preferred population. I have a special interest in teenagers in the LGBT community, which is the lesbian, gay, bisexual, and transgender community, because they face a lot of bullying and a lot of trauma in their lives, and it's not really fair at all. So it's not fair to anybody, but I would really like to work with that population and work with those teenagers and kind of hopefully help them through that, and help them learn to be strong and use music to conquer their fears and their troubles. So that all sounds very kind of out there, but that's my dream. So I hope that you enjoyed the video. I hope that you found it really informative and you learned a lot, and also that maybe it helped you relax a little bit. And so if you're interested in learning more about music therapy, you can visit the AMTA's website. It's just musictherapy.org. They have a lot of information on there because they are the American Music Therapy Association, so they know pretty much everything there is to know about it. But yeah, I hope that you enjoyed the video, and I hope that you just have a marvelous and relaxing day.